You might get to meet me. Erin's another nurse here as well, and you met Janine, she's our unit manager. And Matthew's our physio. So in your handout you've got a few things. Matt will explain some of them to you and I'll explain one at the end. The whole idea of this little foot clinic is to give you a realistic expectation of what to expect from your surgery, your recovery, etc. So with that being said, I'll hand you over to Matthew. He's got a great presentation and we're going to watch that.
Okay, thank you and welcome to the foot clinic. Hopefully we can give you some information that's going to help prepare you for your operation and most importantly the procedures after the operation. What we find is that people sort of don't really think about what's past the operation, and that's sometimes the hardest part. And we'll have some time at the end where you'll be able to try some of the equipment that you'll probably have to use after your operation, and some time for some questions as well. So what we want to cover today is types of foot surgery, what you need to do following your surgery, how you can prepare for your surgery. How long is before your operations? I think you said it was
Next week.
Next week? Anyone longer than that?
Next month.
Next month, great. How long's your one?
Yeah, next week I think.
Next week as well, okay. So there's some things you can do in the next week, but particularly the greater time you've got, because we've got some exercise and things for you to do, is you need to get strong in your upper arms, because we walk on our feet, and when we take away our foot, it's not so easy to walk on. So depending on the operation, you may be non-weight bearing or partial weight bearing, or you'll be able to weight bear on it fully. How long things are going to take, so it's just not the first few days in hospital. Sometimes we're talking about months of process to get better, and then as I said, we'll have some question time at the end. So we'll start with toe procedures. So toe procedures are things like bunion operations. We also do what's called a microbunion, so it's done through a small cut. A DMMO, which is a distal minimally invasive metatarsal osteotomy, which is where they straighten the toes down. So it's done through a very small cut. It's a newer procedure and people get up and going really quickly from those. The wheels osteotomy, chiliectomies and neuromas. So they're smaller procedures which are just almost like filleting of the toes, changing the alignment of the toes. With those operations, they're pretty quick. So often they're an overnight stay. Sometimes even day procedure. So you come in, come out in the same day. With pretty much all our operations, what you'll find is that we like to elevate. Our surgeons are fairly strict on elevation. The problem with feet is that they don't actually heal very quickly. And we're made of water, essentially. And so all the fluid drops down into our toes and it sits there. And if we're standing up on it or it's down a lot of the time, then it just delays the healing process that's going on. And that can lead to infection, it can lead to breakdown, it can lead to blood clots. So what we like our patients to do is, it's quite simple, put your feet up, elevate some more, and then elevate it again. And what we find then is at the time that you go back and see your surgeon, they take your dressings down, your wound's all lovely, and then you can move to the next phase of your rehabilitation. When you've been naughty and you've been on your feet, and the wound's not very good, that can mean that you have to go back into hospital, maybe go on some antibiotics. So it slows the process down. So slow is fast. Sit on your backside, put your feet up on the couch. It sounds easy, it's not. But take it easy, get it healed. With toe procedures, depending upon what it is, it'll lie, and depending also on your surgeon, it'll be non-weight bearing. Occasionally it'll be weight bearing in a shoe. And most often than not with toe procedures, you'll walk in a little sandal like this, which is called a flat shoe, post-op shoe. It's got a stiff sole, so it means your toes won't move around too much and you can weight bear through your heel. Sometimes with bunions, we put you into a low Darko shoe. You can see it's got like a little ski tip on it. That means you can weight bear on the back half of your foot and you'll offload the front half of your foot. So again, it's a heel weight bearing shoe. Once you're in the shoe, you'll be able to progressively weight bear over the next month or so up to about 6 weeks. You'll be able to start motion exercises after 6 weeks and strengthening exercise at the same time. Generally, depending if it's your right or your left foot, we don't like you to drive until you're out of the shoes. They're a bit clunky and it puts a lot of load on from a safety perspective. And then higher levels of activity is 3 to 6 months. As I said, we walk on our feet, so it's harder to do those next level of activities, running, jumping, and those sorts of things. I'm sure you wouldn't be able to do probably much of that sort of stuff at this point, otherwise you would be coming to have an operation on your foot. Midfoot procedures. So as we move back into the middle part of the foot's a little bit like Sydney Harbour Bridge, okay? And so if we get problems in the middle part of the foot, it collapses down, so it needs to be fixed. So we have midfoot reconstruction, sometimes midfoot fusion, where they're making that stiff and they're joining the bones together, and repairs of damaged ligaments in that area. So with these ones, we're probably a little bit more strict. They're a little bit more painful. You'll be in hospital 1 to 2 nights. You need to elevate again for 2 weeks, like we were talking before. With these, you're typically non-weight bearing, so you're hopping, okay? So we don't let you put any weight down through your foot for the first 6 weeks, because that's how long it takes the body to heal. Then often at the 6-week mark, you'll go into a boot, okay? And you can start walking through the boot, and we protect it for up to 12 weeks where we start to wean the boot. You'll start motion exercises around the 6-week mark, where you'll start getting movement back into your ankle. And then we'll start the strengthening exercises around that 10 to 12-week mark as things become a little bit stronger. Again, when you're in the boot, you can't drive, so if you're in a boot, you can't drive until the 12-week mark. Sporting activities with these is more the 6 to 12-month period of time. Achilles procedures, so things like Achilles repair, Achilles debridement, and Haglund's deformities, which is a little bone spur that grows on the back of the heel. Have you ever seen sports people have these? They take a long time also. So getting the gist, feet take a long time. I tell my patients, you have a foot done, expect 1 year until you don't think about it anymore. Okay, and the reason I say that is, it's not going to affect you for that period of time, but you might say, you know what, when I get out of bed in the morning, it still bites me a little bit. At the end of the day, it still aches a little bit, okay? They're normal things that we expect from feet patients. You walk on your foot. It's kind of hard. You hurt your arm, you go to sleep. You hurt your foot, still got to walk on it. Okay, so it takes longer to get better. With Achilles procedures, you're in hospital 1 to 2 nights, depending on pain. Again, there's the elevation for 2 weeks. You're non-weight bearing in a plaster cast for 6 weeks. You then go into a boot for another 6 weeks, and you wean the boot around the 10 to 12-week mark. You're starting exercises and strengthening progressively through there. Driving when you come out of the boot, sport 12 months. And ankle procedures are things like ankle reconstructions, ankle arthroscopies. There's a great deal of variety depending on what they're doing with those procedures. But most typically, you're in hospital from anywhere from day case to 1 or 2 nights, depending on the amount of stuff you do. On average, it's day case to overnight. You need to elevate again for 2 weeks. You may be able to weight bear with this one in a boot straight away, or you may be non-weight bearing for 2 weeks. And then you progressively weight bear through the boot. If it's a reconstruction, it takes 6 weeks for the soft tissues to heal. So you're in a boot for 6 weeks, and then you go into an ankle brace. You start your range of motion exercises at the 6-week mark. So you can see there's a trend here. Bones take about 6 weeks to join, 12 weeks to become solid. Soft tissues take 6 weeks to heal. So they're sort of the time frames where you're going to be really limited in what you can do because we're waiting for nature to heal things up. Your range of motion exercises when things start to heal, so that's 6 to 12 weeks, strengthening the same. Driving when you're out of the boot, sport, 3 to 6 months. And then major ankle procedures, fusions, joint replacements, okay? Again, with these ones, they're sort of end of the road sort of operations, so we really want to make sure that things go right. So we don't want to move them. They're bigger operations, they tend to hurt a little bit more. So the people who have these will be in hospital 1 to 2 nights, depending on pain, elevation at 2 weeks, your non-weight bearing for 6 weeks, okay? Depending on what your x-ray looks like at the 6-week mark is depending upon how much, how soon I'll let your weight bear. But you'll come out of a plaster cast. So typically you'll have a cast on, like a half cast on for the first 2 weeks. You come out of that, your dressing gets taken down, you go back into another plaster cast, fiberglass cast, which is lighter. You're still not allowed to put any weight down through it. And then at the 6-week mark, they'll often put you in a boot. Okay, and then you can start to load through the boot, and you progressively load through the boot over the next 6 weeks. So at 3 months, you start to wean from the boot. Okay, it takes that 3 months for the bone to become strong. At the 6-week mark, when you start to load it, it actually helps the bone to become stronger. So with concrete, and they put the wire mesh in there called Rio. Your body's very clever; it makes its own Rio. Okay, but to do that, it needs to recognise that this is how we use it. So when we start to put gravity down through the boot, the body recognises that this is how it needs to reinforce it, and it makes the bone in the right places. Okay? With this one, range of motion exercise, you're only going to work on the range of motion on the joints that aren't fused, because clearly this one is going to be fused, it's not going to move. Weaning from the boot around the 12 to 14 week mark, strengthening exercises, driving when you're out of the boot, sport and high levels of activity, depends which joints fused. It's the very bottom one that stops the sideways movement of your foot, and it's the one above it that stops the up and down movement of the foot. Often with fusions, the motion isn't great because it's all sort of worn out, and so fusion is typically a pain relieving procedure. Following surgery. Okay, so with any surgery, we expect there's going to be some pain. So there's lots of different ways that we can use pain control. You may have a block. It's where they put an injection into the nerve, and it makes that area that the nerve supply goes numb. Okay, and so you can wake up from your surgery and you go, oh my God, where's my leg? Okay, and it's because you can't feel anything. It's a really effective way of taking away the pain in that immediate post-op area. What the nurses will do is they'll give you some medication before it wears off. Okay, so that as that one wears off, we've got another medication coming in to take over from that. And then we encourage you to take regular medication when you go home to make sure you manage that pain control over the next few days. Now, one of the problems is that pain control, good pain control, can make your tummy get blocked. So we also encourage that you use something like Coloxyl Senna, which will actually help you to get emotion so you don't get constipation. Because it's a big side effect with strong painkillers. Okay? So often you'll go home from hospital with that if you don't have any of that at home. We can have an infusion. So for bigger procedures, like the fusion, they might actually give you something that's just running in the, you can push a button and you can give yourself some pain control when you need it. And it's a really good method of actually giving you the amount of pain control that you need and not having too much. So we can then monitor exactly how much you need. Okay? So they're the typical things that you'll find that you'll have when you're in hospital. Pretty much. Yep. Swelling. Now we've spoken about that. So as I said, we're made of water. So the fluid will drop down. So we really like you to elevate. So we have these lovely pillows, which you can actually get from the Melbourne Orthopaedic Rooms. And they're just a nice, comfortable way of elevating the leg up because you can rest your thigh on it. And it gives you enough elevation at home. Other alternatives are pillows. Okay, people often find that pillows are a bit wobbly though. You need a lot. Bean bags work too. Okay, so you just got to have that foot up. So think of it like a river. Okay, it's going to float down to your toes, which we don't want, or it's going to float back to your hip, which we do want. Okay, so that foot's got to be up. So foot above knee, above hip. Okay, 2 weeks. Takes about 10 to 14 days for that skin to heal and seal over. Okay, and so that's why we're really strict on it. You may hear other surgeons and other people say, oh no, I didn't have to do that. But you know what? Our guys don't have much wound breakdowns. Okay, so it's done for a reason. You need to elevate your foot. I have a saying, do you like bed pants? Right? Because if you get it wrong and it breaks down, then you're going to have plastic surgery. Okay, so just be careful, elevate your foot, be good. Pain. Pain is a normal expectation after an operation. Okay, you've had a surgeon make a little hole in you. Okay, so we expect there will be pain. You'll have some degrees of pain. That's why you have pain control. So make sure you take the pain control, be proactive with the pain control, take it in advance, and then you can wean yourself down over the next few days. But the first couple of days, we expect there will be some discomfort, particularly when you move your foot down. It sort of goes boom, 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 okay, and your head probably go a little bit dizzy. So you just have to take your time, okay? And wound management. At the start, there's not a lot you can do because it's all wrapped up. So it's the elevation again. And then later on, it's keeping it dry, etc., etc. So you'll need to make sure when you go home, you're having a shower, you need to bag it, okay? I sort of say get a big garbage bag, put it around your leg, put a rubber band around the garbage bag, fold it over, and then tape half skin, half back. You'll be surprised what little hole the water will be able to get into. If you do get it wet, hair dry, okay? Leave your dressing dry and intact. Okay, don't go sticking things down your dressing or your cast. Don't go undoing it, changing it. Surgeons will know. Okay, leave it dry. Okay, the best dressing is left alone. Okay, if there's big problems with the dressing, you need to ring the surgeon or you need to ring us.
Is that like 10 days you leave it?
Uh-huh.
Yeah.
Yep.
Cool.
Yep. They'll go through. Each specific case is going to be slightly different, but most typically, leave it. Yep.
Yeah. Cool.
Yeah, some of the minor procedures, they might have a little dressing over it, but pretty much you'll have a big bandage wrapped around your foot.
Yeah.
Okay? Some of the surgeons actually sort of put tape strategically on it so they know it has been filled with. Okay?
Right on.
Constipation we've discussed. Okay, it is a side effect of having painkillers. So prunes, stone fruits, colloidal centre, anything like that, fibre gel, Metamucil, we don't want constipation. Constipation can actually make you more sick than the operation. Okay, so if you find you're getting bound up, make sure, be proactive, have lots of fibre. Discharge from hospital is 9:30 a.m, okay, most typically. And you'll be able to go home in your own car. Okay? Sometimes if you live far away or transport's an issue, you'll discuss that with Sonia and she'll work out alternatives for you. But a lot of people will just go home in the back seat with their pillow on the back seat and have their foot up, so they'll sit sides over the seat, leaning against the door. Okay? If it's a short distance, you can have your foot down for that short distance. Okay, Gait Aides. And this is probably one of the primary reasons why we like you to come to this course. Okay, because a lot of people don't really think about what happens when I go home. How am I going to move? Okay, it's not that easy. So depending on what your balance is like, depending on whether or not you're allowed to put any weight down, there's different things that you'll use. We can use pickup frames. The hardest thing about using a pickup frame is the stigma associated with it, but it has 4 feet on the ground. Okay, so it's a very stable form of transport. Okay, I can put all my weight on this frame, so it will hold you up. Okay, the good thing with the frame, it's like a well-trained dog. Okay, it stays there. Okay, crutches. Get used to that. Okay, you'll be picking them up all the time. So the frame is particularly useful in the first couple of weeks. When you go to the bathroom, you've got to wash your hands, any of that sort of stuff, it's easy. Okay, so a lot of people will like to use the frame. It's also much more stable. But the frame is just moving forward. With all the Gait Aides, it's the sore foot forward. Okay, if it's up, it's a hop. Okay, or occasionally it will be, you can put your heel down and you press down through and step up to them. These fold up, so they'll sit in the car really nicely. The big problem with the frame they don't do stairs very well. Well, they don't do stairs full stop. Okay? So if you've got steps and stairs in your house, not so good.
So for the first 2 weeks where it's non-weight bearing,
Yes.
if I have both feet being operated,
No, you will not be non-weight bearing with both feet. It will be very difficult for you to be non-weight bearing with both feet. So you'll be heel weight bearing. Those are your toes that are getting done.
yeah.
Yeah, so you'll be able to heel weight bear. So you'll be walking with two like this.
Oh, so I can walk like that.
Yeah,
between the two.
it's impossible to walk with
Yeah,
no
that's what I was
feet.
thinking.
So a lot of people, when they have 2 feet done, will use wheelchairs. You know, particularly if they've got a big house or long distances to go, they might get a wheelchair and they can wheel themselves along. Okay, and that can work quite well.
Okay.
2 feet is kind of harder because you don't have a good leg to stand on, and so things take that little bit longer in getting better, and sort of double the pain as well because you know, both feet are going to throb as soon as you get it to the ground. So expect those time frames if you've had bilateral to be a little bit longer. Okay. Crutches. So there's 2 types of crutches. I think most typically when you're non-weight bearing, I always prefer these ones. Okay. With these ones, actually go in your armpits, but we don't weight bear through our armpits. Okay. There's a big bunch of nerves that are really delicate in our armpits, and if you load them, you will get numb fingers, and then that becomes really hard to use crutches. So we actually fitting these crutches, you want about 3 fingers gap in your armpit, and then your hands can push down through here, and then it's just crutches and a hop. Okay? Crutches and a hop. And at the start, I actually only get you to hop to the crutches. As you get better at them, you'll be able to hop through. Okay? But at the start, it's kind of keep everything as a triangle. Okay? Little ones. Okay? It's much more stable. If you can put your foot down, okay, this is my operated leg, here, and then step behind it. Okay, as soon as you load through, that's where your momentum is going to come through and you're likely to lose your balance. So always think triangle on the floor. Nice big triangle. Forearm crutches, people sort of think are a little bit cooler, but they're more wobbly, okay, because we don't have that stability around the armpit. So with the forearm crutches, these move. Okay, so you need to be stronger in the arms. This is a bit short for me, okay? But you need to be stronger in the arms. So typically I use these as soon as you can weight there. Okay, so you can go here, here, and we're walking through it. Okay, you can swing through, okay, but you need to be strong. Okay, so it's a lot harder. And then we have the knee scooter. The knee scooter is one of those things that's really good in theory, but
That's right, I've got one.
around home,
Use it one day.
you only used it one day. Yeah. So I mean, the thing is, around home, they turn like the Queen Mary. Okay, so you know, if we look at this, turn it around in here, okay, and say that's a wall there, I've got to do a 50-point turn to get it around. Now, if you think most people by the side of their beds maybe this wide, so you can't turn around, so you have to be good at going backwards with it, or you can turn and pivot them, but again, you need to have pretty good balance.
And lots of space.
And lots of space. Okay, so these are really good when we have open plan. They're really good for going down long corridors, or if you've had a fusion and you want to go out for a coffee down the shops and you know they're 100 metres away. Fantastic for going long straight lines. Okay, but tight confines, not so good. Okay, so they are good in the right circumstance. Okay, we have had people fall over the front of them going down driveways. You know, you grab on those brakes, it'll go over. Okay, with all gait aids, I say it's really hard to hop with a broken arm, so be careful. Okay, because no one wants to have a foot that doesn't work and an arm that doesn't work at the same time. That means you'll be in a wheelchair. Okay, so wheelchairs can be really good to help people go longer distances. Once you've had that first 2 weeks, you know, you've had 2 feet, for instance, and you're dying to go for Chaston for some reason, you know, you can get in a wheelchair and people can push you around. Okay, so you can go those longer distances. Okay, so wheelchairs can be quite good. For something like a fusion, you know, you might get a wheelchair and you can get a leg extension, so your foot sits out, so you can get out and about, and it's a bit more comfortable for you.
And are there different types of wheelchairs and any particular type that you recommend?
So there's a standard wheelchair which has got the big wheels at the back and you can push yourself. And some people who've had foot procedures may even take the foot plates off and they might use their heels to help scoot around. You know, the thing with wheelchairs is quite good is that you can, say you're at home alone, you can put a little tray on your lap and you know, you can put your sandwiches on it. And it's really hard when you're on a frame to carry stuff. A cup of tea. Often I'll say to people, get a little satchel and you can make a thermos of tea, coffee, and then you can take it to the couch and you're not able to go backwards and forwards from the kitchen too often. So little things like that can make a big difference. There's a transit wheelchair, okay, it's got small wheels, so it's designed for someone just to push it. So you can't push it yourself, okay, so it's a lighter version of a wheelchair, but it's a one that's not self-propelled. So they're probably the 2 main ones, and then you've got electric chairs and stuff, which are a bit fancy for this sort of instance, okay, but you know, they're the sort of things that if you find it's hard to get around, then a wheelchair can help, but in the majority of cases, most people will find the Gait Aides are sufficient.
And do you hire these aids or do you?
Yeah, so with any of the aids, we sort of encourage you to hire them, or you can, like crutches are generally pretty cheap, purchase them, particularly if you've had multiple operations. You'll get your money back, pretty quickly, but what I'd like you to do is to actually get some crutches or a frame and have a go at home before you come in. Because it's actually really different, okay, when you've got bad feet to when you've got, you know, sort of when you've had operated on feet to now. So if you're struggling before the operation on crutches, you need to be speaking to us and we need to come up with plan B and C for you. Right, and ideally that's done before the operation because there's nothing worse than, oh, I've had 2 feet operated on, how am I going to get home? How am I going to survive? And this is one of the things that we see quite regularly in the hospital. People don't really think about the consequences of what's going to get done. Okay, and these ladies will be able to tell you it's challenging. Okay, and it's challenging for a period of time. You know, it gets easier as time goes on, but you know, the hardest thing is the mobility. Okay, so if you can practice and get your balance and your sea legs on this sort of stuff when you come in, crutches are one of those things that's fun when you're a kid and you don't have to be on them forever. Okay, because for 5 minutes is easy, but it's tiring. Okay, and you need to use muscles that you may not have used for a long period of time. So practice. Okay, and then we can say, well, I'm not so good on crutches. We can look at things like frame and wheelchairs as well. Okay, but trying to organise a wheelchair after you've had the operation can be a bit more challenging than it is before the operation. Stairs. Okay, so when you have 1 foot, stairs can be hard. Frames don't work on stairs. Scooters don't work on stairs. Wheelchairs kind of can work on stairs, but it's hard work for the person who has to pull you up. Okay, we have a saying, the good go to heaven, the bad go to hell. It's corny, you'll never forget it. Okay, so what that means is when we go up a stair, we go up with the good foot first. Okay, so we step up with the good foot first, the crutches and the sore foot stays down, and then we push up and lift it up. So the good leg is going to lift us up the step, so the good goes to heaven. Coming down a step, it's the opposite. Okay, the crutches and the sore foot go down first. Okay, because it's the good leg that is going to lower us down. It's a squat. Okay, so it controls movement down. And the Gait Aides, particularly your underarm crutches, they're not very forgiving if you leave them up on the step. Okay, you'll get down the stairs very quickly. So you actually need to think. Okay, and We can work that out with you when you're in hospital if we think there's going to be a problem there. Often you will have the person who's helping you get in and out of home until you're really comfortable going up and down stairs will be on the gravity side. So going up, they'll be behind you because you're going to fall that way. Okay? Going down, you'll come that way. You can, if you've got lots of stairs and you find it really challenging, go up in the bottom. So you can put a chair at the bottom and you can put a chair at the top. And you sit on the step and you just press yourself up each step till you get to the top, and then you lift yourself into the chair. Then you can turn around and walk away from the chair. A lot of people will do that. Okay? Stairs is a process. You just have to think about it, okay, in order to, get through it. But just take your time. Okay? If you have stairs at home, even more reason, get your crutches and have a practice. Okay? So that you know that you're going to be good when you go home.
Just there.
Other stuff you may need when you go home. A shower chair. Okay? We've already spoken about bagging your leg. You're not allowed to put your weight down. You can rest it down. Okay, but that's a bit hard when you're washing your hair. Not a problem I have. And you're shutting your eyes and your balance is going to be a little bit off. Okay, so you can get a chair or a little stool that fits in your shower. Okay, and you can just sit on the edge of it. Okay, and you can do all your washing. If you have a small shower that's not going to really fit anything like that in, or it's got a big lip and it's going to be difficult to get in, if you have a bath, you can get what's called a bath chair. So it's a little bit of wood, typically, that will go across the bath. It's got little screws that just makes it safe. And then you can just get a tap from Bunnings, it just sits on your tap, and then you can make it a self-shower. Okay, so they're sort of alternatives. So then you can just sit on the edge of the bath, swing your legs in, and then put your foot up on the edge of the bath, keep it elevated, and that takes away the hassle of trying to get into, particularly some of the old showers or showers in the bath. Bed stick. So a bed stick is a little stick on the edge of the bed, which helps you to pull yourself up and around. So it just sits under your mattress. If you're finding it's hard to sort of swing your legs around, it's something that's nice and easy. A footstool. So say you don't have a couch, or you need something to put your foot up, it helps you to elevate your foot. A high back chair, again, if you're sitting on your back, on your butt for 2 weeks, and particularly if you have a history of back pain, you've got to watch your postures, okay? A lot of people find that things start to seize up, other areas of the body start to get a little bit stiff, so something like a high back chair, is a little bit more supportive. You're not got a banana like you go on a couch or in bed, so those sorts of chairs can make a big difference. Recliners in theory are quite comfortable, but you can't get your foot underneath to get up, and so they're actually quite difficult to get in and out of, unless it's one of those electric recliners that sort of half lifts you out of the chair as well. And you will need lots of pillows. Most women have lots of pillows, I'm not sure about you. There's some sort of inverse rule about 10 pillows plus 1 on the bed. That's what my wife has anyway.
It's just planning a shopping spree in my head then, so I'm off.
Yeah, you can just go down to bed, bath and table something.
That's it.
And then there's some exercises which I'll put in your packs. So if you care to do them, they're mainly arm and balance exercises because that's what we need from this operation. So you need to be strong at pushing down. So if I only got you to do 2 exercises, start working it just in the chair. If you put your hands on the arms of the chair, push up and lift your bottom up and down off that chair. Okay, because that's the muscles that we're going to use when we're hopping. And the other one, on your good foot, don't have one, stand on your good foot, okay, and practice your balance. Because that is what's going to do most of the work for the next 6 weeks. Okay? If that is easy, shut your eyes. Okay? Then it becomes much harder. So your balance comes from your eyes, your ears, and your joints. Okay? So if we take away the eyes, it's going to make your joints work much harder. And that's going to be part of your rehab as well. You'll do a lot of work working back on your balance. Okay? That's a really important thing. So, does anyone have any questions? Nope. That's nice and easy. So would you like to come and try some Gait Aides? Sonia has a checklist, okay, of stuff that you can tick off and make sure you bring into hospital and stuff that you've got to organise before you come into hospital. Obviously, Sonia's your resource if you have any questions before
Yeah,
your
so I
operation.
do pre-admissions. So you'll hear from me a few days, maybe even just the day before surgery. If you've got questions before then, like Matt said, feel free to ring. And I've got a checklist here that you can use, and it covers everything that we would love you to be thinking about before you come into hospital, even down to things like food, getting organised, especially for people living on their own, and maybe to get a good stock of Panadol at home, because your anaesthetist will organise some analgesia for you to take home, but the nurses will tell you when you discharge that Panadol is also part of that regime, so have some at home ready to go. As Matt mentioned, constipation can be a really big problem for people, so even pre-purchase some Coloxal ready to go when you get there as well. Now with these bolsters that Matt was talking about, the girls, the receptionists over at the MOG rooms will have them there, so please try and pick one up just a day or two before you come to the hospital. You don't need to bring it in with you because we have some here, but we keep ours here and yours will be ready for you when you get home. And another thing on the checklist I've put is some gar bags and tapes and things like that, just so you don't get home and think, oh, what did Matt say about keeping my foot clean and dry? It's all ready to go.
There are bags you can get through the chemist or eBay where they've got like a gasket and you pull it over and you Velcro around, but you know, that's another expense, and so some people love them, but the garbage bag will do the job just as well. If you have sensitive skin or sort of papery skin, then I think they're a good alternative, because once you're taping your leg for a long period of time, we don't want you to damage the skin, the good skin on your calf, but that's another option that you can have.
Yeah.
We've also got some brochures here for suppliers, so the people who supply the crutches and all the equipment that you may need at home. So we've got some from, I think, north, south, east and west, depending on. There's also a company that do online and they'll deliver to home. And they'll pick up from home. So there's lots of different companies that you can use. A lot of people will use friends and family. You know, it's amazing what hides in people's sheds. So you know, you may find that there's some of that stuff, you know, fairly ready at hand.
Your local chemist as well.
Like chemist, yeah, absolutely.
With the bolster, if I'm doing 2 feet, do I buy just one bolster or two?
So I should have mentioned too, the MOG rooms will hire them. They cost $10 a week.
Right.
So for the 2 weeks of elevating, and yes, for 2 legs, 2 feet, you will need 2.
It's probably a bit narrow to put. I mean, some people, you know, for a short period of time, will put 2 in it, but no, it's probably, yeah.
So we have to organise that a couple of days before.
Yes.
Because last time nobody told me that. So
Yeah. So I will remind you on the day, but sometimes I'll ring you the day before. And especially for people in the country, it's really become an inconvenience now for picking it up. So yes, if you're over in that way between now and your operation, I know that they do like it to be as close to your operation as possible though, just so they're not letting them out to everybody and losing track of them. And
They're
ladies,
hard to
we
find
want,
as well, you know, they're from hiring elsewhere. I think the guys get them made up.
Yeah, we haven't actually found anywhere else to hire them.
Yeah. And also please take off your nail polish. I mean, it's on the checklist, so I won't bore you with everything that's on there. So take off your nail polish, Paul.
I generally say, I don't know if it's right or wrong, but don't shave. Because if you use a razor blade, that can cause microcuts, which can cause your operation to be cancelled. So they'll take care of any clipping that needs to be done before the operation.
Do we have to get the moon boots ourselves, or is it?
If you're having both toes done, you won't have it. So
I'm getting.
these.
Say 2 weeks, so it might be that.
So you'll have these shoes. Okay. So if you're having the bunions, you'll have these ones. Depending on your surgeon. And depending on the axis that they use to have the operation. Most typically these are fitted 2 weeks after your operation at your review when they take the dressing down, but occasionally with 2, depending upon your surgeon. We have one surgeon that makes a little fiberglass shoe for you, and that's part of your dressing, and some of the other surgeons will put you straight into these. So you'll either have it when you go home, or you'll get it at the 2-week review.
So we don't have to worry about it.
No, you don't have to worry about those ones, no. Okay.
Yeah.
Any other questions? Nope. So come and have a little try, and if you do have any questions, my details are in the sheet. You've got Sonia's details as well. Please call us, okay? Because we'd rather you are well prepared when you come into hospital, and that nothing's a surprise.
I just want to add one more thing too. Try and organise your transport home from the hospital. Have someone pick you up. I run through that when I ring you, but occasionally people don't think of it, and then they're hunting for which relative's going to pick them up.
Yeah, and lunches. What are you going to do for lunch?
First coffee down the shop.
Because, you know, people might have someone at home with them, but they're not there, and it's hard to carry or it's hard to make stuff. So, you know, either go back to school and, you know, you got your little lunch box
Rack
for
up
the day.
Uber Eats meal.
Yeah, Uber Eats or you know, light and easy in the microwave. That sort of stuff can make a difference. Sometimes carrying things is really hard. So, you know, little satchels and Tupperware, so it's all sealed up and you can stick it in and then go back to the couch and eat. I sometimes say use an office chair. You've got to be careful with office chairs because they move in 360 degrees, but you can sit on the chair and just scoot yourself along. Just be careful you don't tip over.
When you come off your bed, so you don't fall.
And also be careful where there's rugs or carpet to boards because the wheels stop and some office chairs have kind of really springy backs. So just slide. But they're little hacks that you can use that make a bit of difference. But be careful because it doesn't have brakes. It's easy to slip away. So normally if I suggest you using a stool, you park it against the wall so that it's a sit down. It's only going to go one direction. Okay.
You just get